My name's Dr. Brady Wyrick, and I'm the only board-certified chiropractic neurologist in Southeast Idaho. I've been in private practice now since 2006 in Idaho Falls. I consult with over 1,000 doctors around the country, and I'm the founder of Idaho Chiropractic Neurology and the website painfreeidaho.com. Today we're going to talk about how to end your struggles with fibromyalgia. Are you tired of running from doctor to doctor only to play Russian roulette with the different medications? Here, try Lyrica. That didn't work. Try this Cymbalta. It seems like they're coming out with a new medication every month, only to see it fail. Are you tired of taking drugs that don't fix the problem? Do you continue to struggle with constant pain day in and day out? Are you watching this video because you have been told there is no cure for your fibromyalgia? Or you've been told that it's all in your head? Or you've been told there's nothing we can do? Or you've been told your insert name of test here came back normal? We don't know what's wrong with you. We don't know how to help you. I'm here to tell you that there is new hope. There is something that we can do. Let's talk for a minute about what makes us different from any other fibromyalgia specialist or doctor that you have seen. Well, the difference is we treat you both metabolically and neurologically. You are watching this video because you or someone you love is suffering from fibromyalgia. I'm here to tell you that no stone is left unturned to determine the exact cause of your fibromyalgia. I will guarantee you that no one has told you what I am about to tell you. I'm going to address what makes my program unique and how I successfully treat fibromyalgia. So how do I treat it? Well, I treat it by using specific metabolic and neurological protocols. So let's talk a bit about the metabolic testing and treatments. The first thing we check for is sensitivities. We check for food sensitivities for gluten, which is a protein found in wheat, rye, oats, and barley, milk, eggs, yeast, and soy. If you're sensitive to any of these foods, it could be making your fibromyalgia worse, as it will increase inflammation in your brain and throughout your entire body. Here are some of the symptoms of these sensitivities: chronic pain or fatigue, frequent indigestion, bloated after eating, frequent loose bowel movements, constipation, mouth ulcers or sores, and vomiting often. The only way to find out if you're suffering from any of these sensitivities is to run the tests. We look at complete blood panels. By using specific blood tests such as thyroid panels, complete metabolic panels, lipid panels, CBCs, or complete blood chemistries, we can assess your thyroid, adrenal glands, liver, kidneys, red and white blood cells, gut function with any of the above lab tests. All can be affected with fibromyalgia. By addressing any problems with your thyroid, adrenal glands, blood chemistry, or gut function, we can help you heal faster. The complete metabolic panel allows us to check the blood glucose levels, since glucose and oxygen are needed by the brain to function properly. You can test the adrenal glands with a test called an adrenal stress index. This is a salivary test, much like DNA testing. The adrenal gland sits right above the kidneys, and these are your stress organs, meaning that they react to stress. If a patient has been or is currently under stress, this test is absolutely crucial. If the patient suffers from insomnia and or diabetes, this test is a must. It will measure your cortisol levels. We also measure your immune panels. This is extremely important. Your fibromyalgia could be caused by an autoimmune condition. Your immune system could be attacking your brain and nervous system without you even knowing it. This is why the immune panels are so important. There's two parts to the immune system that we're concerned about. These cells are called Th1 and Th2. Th1 cells are the army that kill the bad guys in your body. Th2 cells are what tells the Th1 cells what to kill. If Th1 cells and Th2 are out of balance, this is the root of autoimmune diseases and could be the root of your fibromyalgia. I guarantee you that your doctor did not assess these values. The second reason why we are successful at treating fibromyalgia is because we use specific neurological testing and treatments. You see, there's certain areas of your brain that are causing different parts of your symptoms. For example, the brain fog that you're having may be caused by a decrease in the firing of your left brain. Your dizziness could be caused by problems in the back part of your brain called the cerebellum. You can't sleep, and your body's in pain all the time because the top of your brainstem is overactive, or that midbrain portion. Our treatment addresses the root of all of these problems. How does it do that? Well, the nerves are like muscles. You exercise them, they get stronger. You don't exercise them, they get weak and you lose them. So we find the areas that are weak and we do exercises to strengthen them. One of the things that we use is oxygen therapy. Oxygen is fuel for your brain and nervous system. Your brain and nervous system need two things to survive: fuel and activation. Fuel comes in the form of oxygen and glucose. By using oxygen, we will help you heal faster. By using exercise with oxygen therapy, we can increase the firing to your brain. By increasing the firing of your brain, we help with many chronic conditions, even fibromyalgia. We use specific brain-based therapy, such as vibration therapy. Vibration fires the back part of the brain, called the cerebellum, who we talked about before. One of the functions of the cerebellum is to control spinal muscles. We may also use auditory, visual, olfactory, and caloric stimulation to increase the firing of your brain. We use what we call laser therapy. In our office, we use the Chattanooga Class 3 laser. Laser therapy helps heal tissue and gets you better faster. We also use non-surgical spinal decompression that creates negative disc pressure in between the discs in your spine. This removes pressure off of nerves and also provides a slow stretch to the muscles, which fires up the spinal cord to increase the firing of the brain. Once we have run the necessary tests to determine the specific cause of your fibromyalgia, we can successfully treat you via proper neurological and natural nutritional protocols. Now, I want you to ask yourself the following questions. How has your fibromyalgia affected your relationships, your finances, your family, or other activities? What has it cost you in time, money, happiness, and sleep? Where do you picture yourself in the next 1 to 5 years if this problem is not taken care of soon? And what is it worth to you if we could improve your condition? The last thing I want you to do is I want you to share this video. If you're watching it on DVD, share it with a friend. If you're watching it on the internet, copy and paste the link on Facebook, on emails. Share it with your friends. Now, last thing, I want you to ask yourself, am I a candidate for Dr. Wyrick's treatment? Not all of our patients are accepted into our program. I will make a determination of treatment acceptance after an initial evaluation. To schedule that evaluation, call right now 208-523-1620, or you can visit my website at painfreeidaho.com. It will change your life. Thank you.